As a medical intern at a rural nursing home in India in 2002, I became interested in the care of older adults. Geriatrics as a specialty did not exist in India at the time. There was no geriatrics curriculum in my undergraduate medical education. 14 years later, in the United States, I became clerkship director at a major academic medical center. As an immigrant and as an international medical graduate receiving this national honor from the Alliance for Academic Internal Medicine, I feel very humbled and deeply acknowledged for the hard work of past decades. However, no program can be created, let alone be successful, without the tireless efforts of a team, which I have been very privileged to have. This educational program on anti-ageism has given me more than I have put in it. The insight from our students has only amplified the passion we have towards providing care for older adults that is equitable and free of bias. Having learned from and inspired by the work of Dr. Pangaro, this award named after him is very special indeed. I'm hopeful that this award can spur us to be more creative in integrating principles of equity, inclusion, and diversity in medical education across training levels and across specialties. The COVID-19 pandemic demonstrated how racism and ageism can negatively impact the care of the most vulnerable of our older adult population. Thanks to the educational grant funding in 2021 from the Alliance for Academic Internal Medicine, my colleagues and I were able to put together an innovative anti-ageism, anti-bias curriculum within our ambulatory care geriatrics clerkship for Mount Sinai medical students. Our goal was to study medical students' awareness of ageism in the clinical environment and implement a curriculum to reshape their attitudes towards older adults. In addition to influencing medical students, we have provided staff development at our local geriatrics clinics and taught nationally to interprofessional audiences. Our work has shown that the integration of anti-bias behavior and communication strategies into clinical patient care is relevant, and this education is likely to result in improved attitudes and behavior. And we hope that it can enhance patient-level outcomes in the future. Dr. Robert Butler, who was the founding chairperson of our Brookdale Department of Geriatrics and Palliative Medicine at Mount Sinai Hospital, where I am, introduced the term ageism to the world in 1969. Transforming Dr. Butler's vision into curricular programs has become a calling for my colleagues and I over the last 3 to 4 years. This grant, and then the award, will continue to motivate us to integrate anti-ageism and anti-racism teaching in undergraduate and graduate medical education programs across the health system. There are just too many people to thank for my getting this award. First, I want to thank AIM and CDIM for providing me a professional home and the grant opportunity in 2021 that helped jumpstart this curriculum. I want to thank my core team members at Mount Sinai, Drs. Stephanie Chow, Noel Marie Javier, Roseanne Leipzig, Greg Hendrickson, and Ms. Sharon Forbes for their tireless dedication in keeping this curriculum going. This work would also not have been possible without the support and encouragement of numerous colleagues and mentors like Dean Thomas and Dean Muller. And very importantly, the Mount Sinai medical students, who are just the biggest advocates for our patients and constantly pushing us to improve. Finally, I would be nowhere without the support of my family, especially my parents, my wife, and kids. My parents, both professors and scientists in India, have had illustrious careers, mentoring tens of students. From very early in my childhood, I benefited greatly from their philosophy of education, their passion for science, and the fruits of lasting professional and personal relationships. And I hope I can inspire my mentees and students and my children to do the same.